The kidney is a vital organ in the body, performing functions of removing waste products from the body, balancing body fluids, releasing hormones that regulate blood pressure, among other key functions. Estimates show that 4 million Kenyans have chronic kidney diseases, with a significant proportion of this population progressing to kidney failure. Out of the 4 million Kenyans with chronic kidney diseases, about 10,000 people have end-stage renal disease and require dialysis. Yet, only 10% of those who need dialysis are able to access the services. According to the Ministry of Health, a greater percentage amongst the 4 million Kenyans with chronic kidney diseases come from the central region due to a high prevalence of non-communicable diseases in the region.
What we've noticed as a Ministry of Health in our research and in our assessments is that kidney disease is on the rise, particularly in this region because of non-communicable diseases such as hypertension and diabetes.
With an increased need of dialysis services, the Pcea Chogoria Hospital has stepped up the fight against kidney diseases by launching a dialysis center.
And so, ladies and gentlemen, at this juncture, it is my pleasure to now officially open this center.
And now that we've made them accessible in form of reducing the distance, and as the CAS has said, also affordable because NHIF is covering that, and they can get 2 sessions per week, then we are proud of this as a hospital.
In partnership with the African Health Network, the dialysis center will serve the Mount Kenya region population in other parts of Kenya to treat, prevent and improve the quality of life.
The kidney center is absolutely crucial and very important and useful when it comes to managing kidney disease. And so the center today here will go a long way in improving access to services for residents of Chogoria, of Tharaka Nithi, but also neighboring counties.
So what Chogoria is doing is a very good thing because you can be sure that the neighborhood here, those people not even in the immediate neighborhood, wale watu ambao wametoka karibu area Meru County, Tharaka Nithi County, even to some extent Thegu County, utapata wakija hapa sababu mahospitali yenye dialysis unit si mengi. So it was a very timely investment.
It is a journey that started in 2014.
At that time, only 28 patients enrolled. However, the unit had several challenges, mainly which were financial and affordability, and because of that, we unfortunately lost about 15 of our patients. Some of them had to go to other centers that were more affordable. Others, unfortunately, we lost them. They went back to America. So in 2016, a candle lit, and the center was accredited by the NHIF. And this meant that more patients could have affordable dialysis, and then those who could have the chance got the chance that was much needed. Unfortunately, in September 2016, the center had another mishap and closed due to logistical problems, mainly in repairing the machines that had served their purpose for 3 years.
Now, a world-class renal dialysis unit, the center is unique, ready to serve the community better.
Witness a step that I believe is going to make a lot of change in the region. Secretary has a hospital, and of course on behalf of even the church itself, we are happy to be part of the ongoing reforms and efforts by the Kenyan government and society in order to answer the president's call in regard to the big four agenda, and healthcare tops the list.
Maana tulikuwa na vitanda 4 vya dialysis, sasa tumeongeza na sasa zimekuwa ni 8. Kwa hivyo ni kusema ya kwamba tulikuwa tumewashughulikia about 8 patients per day. Kwa sasa tutakuwa tunashughulikia 16 patients per day. Hiyo ni kuonyesha ya kwamba tutawafikia watu wengi, na hata the cost hata nayo pia inapungua, na tunashukuru because tunaguza the community. We are reaching out to the community with health.
There before, we have had many cases of people going for dialysis in Nairobi, in Kenyatta, and all the hospitals in the city. But now that the services are brought near to the people, it will go away, a long way in alleviating pain, and also in terms of expenditure when it comes to the care for the people who need that service. We are grateful to God.
Hello and welcome to Health Nuggets. It is a special episode of Health Nuggets, for we are coming to you from Chogoria Hospital. Remember, Chogoria Hospital launched its kidney center last Friday the 16th. And we are coming to you live to bring you more information about that dialysis center and what it means to our health. And I'm being joined by Nick Pereira, who is the CEO, Africa Healthcare Network Global. Thank you so much, Nick, for joining us on Health Nuggets.
Thank you, Ida, for having me. This is a pleasure.
So why Chogoria Hospital, and why did you choose to partner with Chogoria Hospital to bring these dialysis services to Kenyans?
So for our organization, we focus on partnering with faith-based institutions because their ethos is patient-first centric care. And with Chogoria Hospital, the focus of the hospital is to increase access to care at an affordable price, and also to increase awareness of disease areas such as kidney disease, which we handle. Chogoria Hospital in particular, the reason it was attractive to work with the hospital and the reason for the need was the hospital had an existing dialysis center with 4 beds, and at that point in time when we had met, they were at capacity and in fact had referred out over 70% additional patients in the past year to other centers, including all the way to Nairobi. So for us, we viewed it as a symbiotic partnership whereby we could work with the hospital to expand access in this region such that patients don't have to travel the distance to Nairobi for care and can get the highest quality possible.
Well, you mentioned that you are a world-class dialysis center. So what does this mean? What bed capacity does the dialysis center have? And what does this mean, or what needs is it coming to cover?
So absolutely. So the first thing I'll say is on the what needs. The first priority for us is not actually dialysis, it's preventative care. And that goes to ensuring that patients who are at risk for dialysis, patients with diabetes, hypertension, and other diseases, are managed appropriately such that they don't develop kidney failure and require dialysis. In addition to that, for patients who have kidney failure, and it's called chronic kidney disease, if we can work with them early on, we can actually reverse the progression of the disease so they don't require dialysis. But then when it comes to dialysis, ultimately, when you have chronic kidney disease and you get to the point when your kidneys have fully failed, you're required to be put on a dialysis machine. And so when we think about world-class, we think about the quality of care standards that we bring, ensuring that the patients are achieving the highest adequacy rates on dialysis, that they're receiving all the necessary medications that go with dialysis, such as erythropoietin, iron. They receive all their lab tests, and their nutrition is also managed well. All of this at this center is done free of cost for patients. And then when it comes to the size of the center, this dialysis center is the largest facility in all of Mount Kenya, with current 10 beds and a capacity of 18 beds in total. In addition to that, one unique element is we provide comprehensive care for also patients with HIV, hepatitis C, and hepatitis B. And finally, in the next 2 months, we'll be launching dialysis within the ICU, which is the intensive care unit, such that patients who are dealing with other maladies or illnesses that cannot travel to the dialysis center can be treated in the ICU where they're receiving intensive care.
Okay, so you said you target faith-based hospitals, yeah? And I believe these could be related with finances. So how is the finances for people who come here? You just mentioned that it is the largest in Mount Kenya. What was the challenge in terms of finances, and how are you dealing with that?
So I think there are 2 elements going on right now. I think, as many know, Kenya is moving towards universal health care coverage, and with the NHF enrollment, which I hope over time more and more individuals self-enroll, you have comprehensive coverage for dialysis in country. And so that ensures that in the event that you require such a service, you won't have to pay anything to receive it if you are an NHF cardholder. However, the reality is there are many that don't currently have the NHF insurance. And so those who are cash patients, our goal has been to reduce the cost of dialysis relative to other facilities in both Mount Kenya and that's more broadly in Kenya, such that it is more affordable for those who are paying out of pocket.
So you've mentioned some of the diseases, that is diabetes and hypertension. So of course the dialysis center comes in for treatment. But even before treatment, prevention is always better. So how do we prevent ourselves, or how do Kenyans prevent themselves from getting these non-communicable diseases?
Yeah, so I think non-communicable diseases are known as lifestyle diseases. And what that means is, as our lifestyles improve, the unfortunate reality is we are higher risk of getting diseases such as diabetes, hypertension, cardiovascular disease, kidney disease, etc. And so I think the reality is a lot of it is related to what and how we live our lifestyles. So exercise is of course a great way to keep your body in shape, but also prevent obesity and prevent diabetes and hypertension. Managing your diet, not eating overly greasy, fatty foods, not overeating sugars, managing your blood pressure as well. So these are all elements of ways to better manage your body and thus reduce the risk of you having a non-communicable disease. And non-communicable means you can't give it to someone else. So it's really something we're giving to ourselves by living.
It's up to you.
Yeah, it's up to us. We're living a unhealthier life, and that's part of grabbing a mandazi on the side of the road or a chapati versus eating some good home-cooked meals. And it's those small changes, especially even with when you're choosing to go to work. Do you take the elevator up 2 floors or do you walk the stairs? It's your choice to make. I would advise taking the stairs. If you're going to the office and you can bike to the office or to your job, take a bicycle rather than jumping on a bajaji or a moto. Because ultimately, those are all ways of improving your health. And also, you'll look better as well.
Exactly. Okay, so saying that this is a world-class dialysis center, it means it's either the best in Kenya or the best in Mount Kenya region. And there is the aspect of nutrition. So what need did you see for you to bring these services here at your dialysis center? And why should I come to Chogoria Hospital, Kidney Dialysis Center, and not go to any other hospital?
So I think it's the management of the continuum of care, managing patients from preventative care, managing their diabetes, their hypertension. Once you're on dialysis, we provide all the services required free of cost, while many hospitals charge on top. Even if you're an NHF holder, many hospitals will charge on top additional fees for you to get access to the injections, the lab tests, and then and food as well. All patients receive a meal while they're on dialysis here. And so I wouldn't say we're world-class in all of Kenya, because I think that's a pretty strong statement to make, and I think we'd like to see everyone improving their quality. So if we show what high-quality care can be in the region, our hope is other centers will follow suit. And ultimately, it's on our clinical officers, our medical officers, our physicians, and our nephrologists to work with the patients to manage the care on a monthly basis, on a daily basis. But most importantly, it's our dialysis nurses, our nursing assistants, our renal nurses, and our administrators. All of them work together. But then there are additional ancillary services, like having a nutrition team at Pcea Chogoria Hospital that works directly with every single patient to ensure that they are following the nutrition plan that has been charted out for them. Ultimately, though, it's on the patient to adhere to the doctor's advice, the nutritionist's advice, and the renal nurses, the registered nurses, the dialysis nurses' advice for the best-in-class patient care experience.
All right, so there are always challenges. I understand that you just launched this Friday, but you've been in operation for a period of time. So what challenges have you faced so far? Or what are some of the challenges that you've foreseen and you're trying to overcome such challenges?
I would say the biggest challenge to date has been on the awareness side, getting patients to come before they require dialysis. And a perfect example of that is we announced far and wide just 2 weeks ago that we were holding a camp free of cost for a nephrologist review. And only 6-7 patients came for checkups. The reality is, if you don't do this, we end up seeing patients come when they're end stage on a stretcher being brought by the family requiring emergency care. Emergency care will never lead to the best outcome, as patients who are well managed, who are seeing their doctors every year, getting their continuous checkups, and then if they do require dialysis, they can walk in, have the procedures done, start dialysis on their own, all while being awake and aware of what's going on. So I think that has been the largest challenge, is ensuring that patients understand they need to work to identify it early, because the later they identify it, the harder their lives will be. And it's not just kidney disease. One of the largest comorbidities, or another word for comorbidity, is one of the largest additional diseases that goes along with kidney disease is cardiovascular disease. And so then you're not only managing your kidney, you're managing your heart. So it's very important that patients do that. And that reduces the strain on the hospital as well, because when a patient comes on an ambulance, it's 10 people managing one patient.
Exactly.
So I would say that's been the biggest struggle to date, is really getting patients to be proactive about their own health care.
So any other thing that you'll want to add?
I would say we've enjoyed the partnership with Pcea Chogoria Hospital. We are expanding across Kenya. We currently have 4 facilities stretching from Mumias and Kakamega to here, and we look forward to continuing to work with faith-based hospitals and the government to expand access to renal care, but more importantly, expand access to preventative care.
Thank you so much for your time, and thank you for creating awareness about not only just kidney diseases, but non-communicable diseases at large, and just telling our audience that prevention is better than cure, yeah? Thank you so much for your time.
Thank you, Ada, as well. Have a great evening.
So we're just here to put into practice of everything we've heard from the CEO of AHN, that is Nick Pereira, and I'm being joined by Msafiri Moses. Msafiri, thank you so much. So Msafiri Moses is a trained nurse and is just going to take us through. This is a
dialyzer, a dialysis machine. The brand is Baxter machine, AK98. This machine, it helps us to do dialysis, hemodialysis, because we have 2 kinds of dialysis, peritoneal dialysis and hemodialysis. But this is hemodialysis machine.
Okay, so when you say hemodialysis, what does that mean? Just for our audience to understand.
Just hemodialysis is it's an operation which helps to filter the blood of the patient. Referring to the normal functioning of the kidney.
All right, so you can just teach us or just tell us how it works?
Normally this machine doesn't work itself. It's having a software that monitor everything happening here. And it helps us to make the solution, which helps us to remove the waste from the patient. Then here we set everything we want to do to the patient. We set the parameters through this machine. Then we use the consumables. This is considered like blood lines. Blood, you know that we are having 2 vessels. The arterial, this is the red one, marked by red color, and the venous, this one for blue colors. Now, this is considered like the venous blood line, and this the arterial blood line. Now, here we are having our dialyzer, which is artificial kidney. This is our artificial kidneys. this is the laser which filter the blood of the patient. Now here we're having the bicat, which is a sodium bicarbonate, and we have this soft part. This is a citric concentrate.
So this is it just purely water or?
No, this is the citric concentrate containing the electrolytes that we're having in our body, because referring to the normal functioning kidneys, it regulates the electrolytes in our body. Now through these electrolytes and this sodium bicarbonate, our body regulates the acid-base balance. Now this is a base solution and this is an acid solution. Through this, the combination of base and this acid with our water, because this machine uses 30 liters per hour, then that water with this basic form and this acid, it's combined to form a dialysate. That solution is containing the electrolytes, the base, and the water. Through that solutions, now the dialyzer, which is having two compartments, blood compartment and dialysate compartment. Now, through the principle of hemodialysis, we are having diffusion, osmosis, convection, ultrafiltration, reabsorption. All those principles of hemodialysis occur in this dialyzer. Now, with those principles of hemodialysis, it helps to remove fluids, electrolytes, to make sure the patient will be fine with the normal range of electrolytes. If he's having hyperkalemia, the patient will go out at home with a balanced potassium.
So is it okay for me to say they help the body perform the function of a kidney?
You say the dialyzer?
Now the entire process. Yeah.
This entire process, it functions like a normal kidney.
Oh yeah.
But there are some functions that it can't work, like blood production. This machine can't produce blood, but we give erythropoietin, we give iron sucrose, so that we can stimulate the body of the patient to make blood.
All right. So that's it.
That's it. But in short, this machine helps us to remove extra fluid from the patient. The patient is having fluid overload. We'll set the machine according to the assessment. Then we will remove some fluid from the patient. If a patient is having electrolyte imbalance, for instance hyperkalemia, the patient will go with the normal potassium. Yeah, from there the patient will be having good health.
All right. Thank you so much, Msafiri, for your time. Yeah. Okay. We've heard from Nick Pereira, who is the CEO, AHN, and we've also heard from Msafiri Moses, who is a trained nurse. Remember, this was a special episode of Health Nuggets where we were bringing to you what exactly is in the dialysis center at Chogoria Hospital. Just to tell you that Chogoria Hospital launched its dialysis center that is on the 16th last Friday. So continue tuning in to Health Nuggets and CAC TV. I've been your host, Aida Munzati. Until next time, your health matters.